So, without further ado, I'm going to introduce Helen and let her speak for about 45 minutes, and then we'll have a discussion afterwards.
Thank you all for coming on a Saturday at 1 o'clock when we can do other fun things. So I've got some, you want the bad news or the bad news? Which do you want first? Actually, I want to start out with some first principles about when we talk about healthcare. And as a socialist and a fighter for single payer, the issue of healthcare it goes right to the heart of capitalism. Because healthcare is for profit, right? Healthcare is a commodity in the marketplace to be bought and sold. And if you can't afford it, well, that's tough, right? If you can't afford it, you're out of luck, and you might even die because of it. Or maybe someone can help you get some money to pay for it, but it's a commodity. The healthcare industry is investor-owned and making a profit. That is their goal. Patient care is secondary to that goal. And most healthcare is in the realm of the private. It's not under the control of the public, although the public uses a lot of its money to fund healthcare. And I just want to put that in contrast to the example of firefighting services in our country. That is publicly funded, right? It's been socialized, that terrible word, socialized, which is supposed to make you think of socialism, which is then supposed to scare you. So we've socialized our fire services because we don't think it's socially acceptable, right, to let somebody's house burn down. That's just not okay. It hurts the individual, their family, their neighbors, the people who live next to them, and it hurts the community. Fire is dangerous, and we can't allow that to get out of control. And I don't know about you. I don't know if you've ever called the fire department, but I called the fire department a couple years ago because there was a fire behind my building. There was all this smoke. And within 5 minutes, 2 huge trucks pulled up to my building. And I met them downstairs, and they only asked me one question. They said, "Hey, lady, where's the fire?" That's all they asked me. They came up to my apartment. They looked out the back. And they never asked me, "Do you have fire insurance?" They never said, "Show us your fire insurance card," which is what you will always get if you go to the ER to a clinic. That's the first thing they ask you. They didn't say, "I'm sorry, we can't help you because you don't have fire insurance, or you have to pay $500 or $10,000 if you want this surgery that could save your life." I wasn't referred to a bureaucracy to get fire insurance to see if I was eligible, or for charity fire insurance. We hear a lot about charity here in this country. And I didn't get a bill for the firefighters coming to my apartment and finding out where the fire was. I didn't go bankrupt because I called the fire department, and I didn't feel like a burden on society. In fact, I felt pretty good for calling the fire department because it meant there wasn't going to be, no one was going to die, and no property was going to be damaged. And every year, I, like many of you, pay taxes for the firefighters to come and to put out fires. And that's how it should be for healthcare. But that is not so for healthcare, right? But that's the way that it should be. So the first principle really is healthcare is a human right that can never be taken away. That's the first principle that we stand on. You won't hear that in this current healthcare debate, which, to be honest, I'm so sick of hearing. It's like I want it to be over already. That's how I feel about it. And I think most people in the country feel that way. It has to be in the public realm, and it has to be socialized. And we have to say, as I just did for firefighting services, it's unacceptable for people to be denied health care. It has an effect on everybody who lives in this country, right? 45,000 people die every year because they lack access to health care. They call them excess deaths. 50 million people have no insurance. 25 million are underinsured. You know some of the statistics. So that's how we look at healthcare. That's really the first principle. The second principle is that of social solidarity. And that is, I think, the slogan that captures that the most in the single-payer movement is everybody in, nobody out. And that really means every single person in, nobody out, unlike the House and the Senate bills. And the current system has us so divided, right? this idea that there are those who are deserving of health care and there are those who aren't. And really, the insurance industry is built on that idea. That is a core idea of the private insurance industry. Everything about that industry reinforces that idea. And a pre-existing condition probably encapsulates it the most. The idea of a pre-existing condition, it's really incredible. They've gotten away with this for so long. The people most in need of health care are the least group of people to get it because they will cost the insurers money. You know, that medical loss ratio. I mean, it's completely upside down. And really, we have a system where the sick are pitted against the healthy. If you have a health problem, and it could be anything. It could be a slight case of acne. It could be a yeast infection. It could be a bump on your skin. If you saw Sicko, there's a whole list of things that will get you thrown into the pre-existing condition black hole, right? It doesn't have to be something really serious. And so then these words apply to you. You're uninsurable. You're a bad risk. You're denied. You're an adverse risk. You've heard these terms. You're not eligible. That's how it works in private insurance. And actually it works that way in Medicaid too, which is a state and federal program. The eligibility criteria for Medicaid is very strict as well. Essentially you have to, or as my patients like to say, you have to be almost dead to get it. You have to have some sort of a health problem that is so serious that you can't work anymore. And you have to be living in poverty. So you have to be really sick and you have to essentially be destitute. And it's means tested. They look at your income and assets, and that's all wrong. You should not look at that at all when we look at healthcare. And it really infuriates people. I spend probably part of every single day explaining eligibility criteria for Medicaid to patients, and it's really infuriating because they say, I'm really sick. Why can't I get, okay, so I'm not so sick, but if I keep going like this and I don't have health care, I will be so sick. What's the point of that? And that's where a lot of victim blaming and a lot of, it's easy to kick down than it is to kick up, where people say, well, why is this person getting Medicaid and I'm not? Why does this person get insured and I don't? And it's really a divisive situation because, right, at least the private insurers, they want healthy people. So if you're sick, you feel discriminated against. So the young are also pitted against the old. And we hear this a lot because they're talking about Medicare a lot. It is the same kind of language that is used to describe the elderly in this country. And they have a term, it's sort of new, called near elderly. Have you heard that? It's just ridiculous. 55 to 60 is the near elderly, right? So we hear constantly, it's so expensive to insure old people. They're using too many healthcare resources. They take too many medicines, right? It's like, sorry if I have to take 10 medicines to keep me alive, right? That's what you feel like saying. Things like, older people, they're living longer. Like as if that's a bad thing, that people are living longer and they're healthier because they're taking 10 medicines, which are helping them do that. And then also the end-of-life care issue. They've really gotten, that's where the death panels came from. They spend so much money on the end-of-life care. In other words, just let them die. But none of their parents or their grandparents, that wouldn't go for Bacchus or any of those folks. It's just for us, right? And, it's like, it's as if it wasn't an amazing human achievement that life expectancy has increased. It's not, of course, as good in the United States as it is in other countries. And we can talk about that, but isn't that an amazing human achievement that people are living longer and are healthier? I mean, that's something that we should hold up and say, this is really incredible. But then, the elderly get it. The elderly get the stick. But then the young invincibles, and there's some of you in this room, the young invincibles, you know who you are, right? You don't have insurance. You think nothing is going to happen to you, and so then you get hit by a motorcycle or you're drunk driving and you end up in the ER and I have to pay for you, right? This is what we hear in the mainstream media, the young invincibles. They just don't care about health insurance, and then I end up having to pay for a divide and conquer mentality when it comes to healthcare. And then kind of related to that is moral hazard. I don't know if people have heard about this. It's the idea that for people who are insured, they just use it even though they don't they don't need it. And so you go to the doctor all the time, like, women like